Hello, dear colleagues. I am Yevhen from the expert group. As regards to what Ksenia was speaking about, the numbers are not overly optimistic, but I have to present one of the infrastructure projects that was supported by the Ministry of Health with financial support of international partners. That's a project for reconstruction of rehabilitation centers in Vinnytsia Oblast. This is a project implemented jointly with the Ministry with the Government of Finance. The memorandum was signed last year. 15 million euro was the amount provided to improve the infrastructure by means of reconstruction of 2 facilities in Vinnytsia Oblast. So the implementation is happening through the Ministry of Health with active participation of the regional administration. The French campaigns French companies are also able to engage, and there is one component that I am going to introduce to you. So the title of the project is Enhancing of Rehabilitation Services in Vinnytsia Oblast. There are several components: reconstruction and modular construction and equipment. The second component is enhancing the network and strengthening capacity. So if we build something and equip something, we want to see how effective these facilities will be, because investments on the work if this is used properly. The facilities should be financially sustainable and have the business plan. So I am a member of the working group on rehabilitation. My function is to avoid duplication of efforts, ensure the exchange of information, etc., making sure that it's in line with the Ukraine's strategy of rehabilitation. So we are implementing this project in the 2 facilities in Vinnytsia Oblast. The first one is Ladezhin. There is the reconstruction of a sanatorium. There will be the orthopedic rehabilitation, neurological rehabilitation, prevention of professional diseases. It's going to be implemented in the general level facility of our capable network. There is a cluster facility nearby, which also will develop the rehabilitation unit, but, well, not far from here, we are launching this huge project. And in Vinnytsia, we are focusing on the Children's Rehabilitation Center. The construction will be happening by means of installing modular beds. There will be an inpatient unit and outpatient unit installed, and this also implies shelters. In Vinnytsia, we assessed that the shelter should be large enough for 300 people, which is quite a big challenge because they are quite challenging in terms of technical specifications and the implementation. So let us now focus on enhancing the system and enhancing the capacity of service providers. This includes technical planning and design support. So this is something that has started already, development of the TOR, audit of the design documentation, making sure it's in line with Ukraine's regulations and requirements. And it's a challenge for our international partners. Next goes financial stability and service performance, the analysis of the costs and resource management. Next, we also have the assessment of human resources, support of the development strategy, ensuring sustainability for the future, launching education and strategic development, development of individual training programs, development of the development plans of each facility, and also coordination between the inpatient, outpatient, primary healthcare, and community-based services. So these are the 6 main pillars in this component. Right now we have a team of over 15 experts, consultants. It's in total 600 working days are required. And what's important to underscore is one of the components that's quite close to us, specifically the cost and sustainability analysis. Why is it so important? Well, because it underpins all the rest of activities. The experts involved, they have been analyzing the economic and financial components of the facilities for quite some time. And here in this slide, we are only given the main arguments to justify why it is important. It is important to develop the subsequent tariff policy. The current policy, as a rule, does not fully cover the costs of a case treated, especially when it comes to rehabilitation. The analytics lays the foundation for future recommendations, and also there are human resources, as we mentioned today. Thank you, Ksenia, for sharing the data. We will surely need human resources, but if one is getting $500 or $600 per month while doing so much work, it's almost impossible to keep human resources and even gain them. So we need to include this component into the rates so that we come up with the right policy. And also to map costs, we need to use the digital data, we need to use decision-making systems. There are big gaps in this regard, and as I participate in different events, I speak to the management of our centers of excellence, I do understand that some of those indicators would require additional training to provide the relevant data. And also speaking of training, as we are renovating facilities, we are investing millions of euros, we understand that there is some amount of joint work that we need to do. WHO supports training in centers of excellence. We also have our project consultants, the head of Ahmadid, who consults the children's units, and we also have the Center of Excellence in Vinnytsia. So we need to have the clear numbers of the cost of rehabilitation per case, depending also on the different comorbidities, the cost of stay of one patient per day. So when I'm asking the management how much are you spending per day, they are saying we are not spending anything, we are paid by the NHSU. But that's not the answer we need to get. So all of these things need to be clear and understandable for the management. And there are two challenges that we have been dealing with over the last 2 weeks. We were developing the TOR. The international partner has some scope of possibilities, but we understand that the presence of parents during the rehabilitation process increases the effectiveness by 30 to 40% in patients under 5 years of age. But in practice, this means double economic load for the facility to accommodate the parents, to provide food, to provide basic services such as a shower, etc. So this is surely not included in the rate paid by the National Health Service. So the facility, keeping in mind the financial sustainability, needs to have some sources for this to happen. The local self-government, yes, so that's a possibility. If we count very clearly how much money is necessary, but if something becomes the responsibility of the local self-government, the results can be quite detrimental, especially if we see that this is a crucial component for providing high-quality service. Also, neurorehabilitation is different from physical rehabilitation. If we are limited in financing and in space, we sometimes compromise, which entails the deterioration of results. So once the infrastructure is limited, the outcomes are limited as well, especially as the costs for these processes are not fully covered. And also the adaptation of structures to meet patient profile is also a relevant issue. So these are just some of the issues we have noticed. In case there is a desire to develop these areas, there are also limitations of financing, of space, etc. We are facing some challenges from the outset. There needs to be an updated approach to financing. For now, the result is not taken into account when paying per case treated. So once we start assessing the quality of rehabilitation and connecting it with the amount paid, then, of course, all of these components need to be taken into account. One more interesting aspect, I'll try to be brief, but we need to have some numbers here as well. We have an expert team who is experienced in different international projects, and over the last couple of years, we have implemented some of this. The costing project financed by USD to cost long-term treatment. There was also cost accounting in emergency departments and also analysis of packages within the medical guarantees program. So I don't have any possibility to explain these detailed projects now, but we can see that international approaches were in use since 2012-2018. So there were some approaches and methods of data collection that enables the assessment by healthcare facility management and the owners of these facilities to do the assessment. And over 600 facilities are assessed. The data are put together, the data from the National Health Service, the medical information systems, medical statistics. All of this contributes to the costing done by the specific facilities. And here we have a hospital in Kiev's Oblast data of 2024. Data comes from March this year. You can see the costs per unit. Yeah, so the cost accounting costs and the cost accounting per one bed per day. And these are the NHSU payments, the blue lines, and also the payments by units, and also the actual costs obtained through cost accounting. Of course, the rates should cover everything, including the utility payments. So, if we include these payments, it doesn't necessarily mean that they will actually be reflected in the rate. So, as we can see, almost in every unit except for neurology, the NHSU financing is not sufficient to cover the actual cost. So the neurological unit with the strokes, it's a priority package, so there is at least some financial benefit. Here the numbers are quite numerous, so you probably don't see them, but this gives a comprehensive picture of NHSU payments under the different packages. And we can see which packages account for the most and the least spending, profits, and payments. So we can see the losses in red, and we can see the gains in green. So this is package 4 of the program of medical guarantees. This is therapy. Their deficit is at the level of 25 million. Only neurology is sufficiently financed, and when we consider all the rest of the units that could be potentially profitable, we can confirm they are not. Why so? It's not about the rates only, it's also about the allocation of long-term patients into the cluster hospitals. So who are the ones treated there? So patients who are staying there because of cardiovascular diseases divided by age and gender. So in the bottom one, you can find the data on the orange background. There are different age groups and the relevant percentages. So while the 1.5 million is spent on them, the National Health Service pays 0.75 million. And it immediately tells us about the availability of long-term care. Such care needs to be provided close to the person's place of residence. They should not be treated in the cluster hospitals because the costs of bed per day are much higher in these cluster hospitals than in the average hospital, and they do not refuse to hospitalize people because they need to provide care. And without the proper guidance, the system overloads cluster and above cluster hospital, which entails negative financial consequences. And in case you are interested in rehabilitation, I assume you are, this data comes from late 2023. This comes from ERP FinHealth. We have a total of 7.2 thousand cases. We are looking into a functional rehabilitation package, and we can see some trends. First, pediatric rehabilitation. We have 3 children's centers. We have the movement rehabilitation prevailing. The complexity level is high, the need in physical therapy is quite high. 42% is about neurological rehabilitation, and we also have high complexity in 18.7%. The most popular group in pediatric hospitals is cerebral palsy and developmental disorder and some hereditary pathologies. So in 80% there is a need for some movement rehabilitation, and over 70% of cases the needs are quite advanced. So let us compare the two facilities, one from the regional level, another one from the city level. It's very difficult to make assumptions here because, yeah, we assume that they are the cluster and above cluster facility, but it's not always the case. And we can see that in the oblast level there is a higher percentage of complex cases, or maybe the patients are not properly allocated, and high level of complexity of cases is more frequently seen in the city hospitals numbers, and again, this may have to do with the ways statistics is collected. Also, we can see insufficient level of community-based rehabilitation, because of which many patients with light trauma also end up in the inpatient facilities. And also there is something like unclear level, which we still can find up to 10%, which needs some refinement in terms of understanding. And if we consider specifically Kiev Region Hospital, we can see that CP1 makes 71% of all cases, but also produces the largest losses. So yeah, we can analyze the reasons for this, maybe some ineffective spending, etc. But it also may happen that they are a magnet for complex cases, which raise the costs and are not sufficiently covered by the existing rates. We will analyze how the rates will change over time, and here is the analysis of financial coverage of rehabilitation depending on the complexity level. So we are looking into the regional facility. We can see the coverage between 80% and 100%, but if we go deeper into analysis, we can see that the costs are insufficiently covered in many cases. We can see the risks of insufficient financing, especially in neurological rehabilitation, and there are some potential needs. So we can concentrate on the specific facilities, then we will have more specific numbers, but we can also see here that neurological rehabilitation has the lowest coverage. We can also assume that the needs and complexity and the payment rates that would be relevant are underestimated, and also it has to do with the facilities themselves underestimating their costs. So there are many ways how we can interpret this data, but overall we need to make rehabilitation effective and financially sustainable. As we have this system in place, we are having meetings with these facilities, and these facilities will be the basis for our costing, as well as pediatric rehabilitation, which is very important. The work we are doing is quite scalable because we already have lots of experience in the international projects and the national pilots. Thank you so much.